Department of Health says lettuce and salad greens could be the source of the Cyclospora outbreak.
Joining us now to talk more about that, Med Team doctor and infectious disease expert Dr. Ed Dominguez. Dr. Ed, thank you for joining us. Tell us, why are health officials pointing to lettuce? And are there any foods here aside from lettuce that could be linked to the outbreak?
Well, Blake, they're pointing to these foods because these are the ones that have been most implicated in the outbreaks across the United States. And the Cyclospora comes in contaminated water. The water is being used to irrigate these plants clearly, and then they're coming to us, and we're getting ill from that. Now, other outbreaks have implicated things like berries, raspberry, blueberries, prepared salads, even the washed salads have been implicated. Cilantro, snow peas, green onions. So with any fruits or vegetables you're buying for the time being, wash them thoroughly and aggressively in fresh water. And if you're going to cook them to 158 degrees.
Okay, some good tips there. And Dr. Ed, a new study in Latin America shows older adults who followed a healthy and structured lifestyle retain more of their cognition. Dr. Ed, how big are the gains and what are the most recommended choices?
Yeah, Jennifer, the gains are big. These are about 55% increase in the cognition scores when they followed these particular structured interventions. Now, what are these? Well, these were the same things we do in the United States, things like improving your diet, more exercise, socialization, but done in the context of the Latin American culture. So, for example, encouraging seniors to go dancing. Dancing is popular, salsa dancing, tango dancing, walking in parks. There's so many parks down there in Latin America, and eating foods that are healthy but in the Latin American diet. Things that we should be doing here reflective of our own culture.
Dr. Ed, something else here. Researchers in Boston are developing a therapy that could block one of the most common drivers of pancreatic cancer. What exactly does this therapy target, and how promising are the results?
Well, the results are very promising, but they're very early. So what it targets are the main drivers of pancreatic cancer, Blake, and these are things that are mutated genes. The one they targeted in this study was the KRAS gene, and they used a specific drug, but they used it in combination with first-line chemotherapy. When they did that, they observed that the tumor shrank significantly, and the amount of DNA tumor that was floating in the bloodstream was markedly decreased. Now, I'm encouraged by this, but again, it's early phase treatment. And secondly, I'm more encouraged by the mechanism because there's so many other genes. What's more important is the way we're doing this rather than the drug that we're using.
All right, Dr. Ed, thank you so much for joining us. We appreciate you.